Gastritis in dogs, an in-depth guide. If your dog is vomiting excessively, it might be suffering from gastritis, an inflammation of the stomach lining. Gastritis can either be acute, meaning it has occurred suddenly and recently, often due to ingesting toxic substances, or chronic, indicating a more severe underlying cause. Symptoms include blood and vomit, unusual stool, and loss of appetite. To diagnose gastritis, veterinarians run several tests and provide appropriate treatment. The prognosis depends largely on the root cause of the inflammation. What is gastritis? Gastritis refers to the inflammation of the stomach lining, often marked by vomiting and/or a lack of appetite. Under normal circumstances, the stomach lining acts as a protective barrier against stomach acid, bacteria, and temperature changes. It also helps repair damaged tissues. When the stomach lining becomes inflamed, this protective barrier is compromised, leading to gastrointestinal discomfort. Irritation of the stomach lining can further result in damage from stomach acid, causing vomiting. Left untreated, gastritis may lead to ulcers and infections. Gastritis is categorized as 1. Acute gastritis. Symptoms appear suddenly and often result from specific causes, such as toxin ingestion. 2. Chronic gastritis. Symptoms are persistent and require thorough diagnostics to uncover the underlying cause. Symptoms of gastritis in dogs. The signs of gastritis are often clear and highly uncomfortable for dogs. Vomiting is the most prominent symptom, but other indicators include vomiting, frequent and severe. Vomit may appear black, bloody, or contain bile or foam. Objects or food that cause the irritation may also be present. Nausea, often shown by excessive drooling or teeth grinding. Abnormal stool, may include blood, appear black and tarry, or present as diarrhea. Reduced appetite, a dog may eat less or stop eating altogether, sometimes leading to weight loss. Pain, stomach pain is common, often causing dogs to arch their back or appear uncomfortable when their abdomen is touched. Lethargy or depression, dogs may become less active or appear downcast. Increased thirst or dehydration, resulting from excessive vomiting and fluid loss. Vomiting is a key symptom. Vomiting in gastritis can range from occasional to constant and is often more severe than mild stomach upset. The appearance of vomit can vary based on the cause of gastritis. For example, dark or bloody vomit indicates more serious conditions. If your dog frequently vomits, seek veterinary care immediately. Abnormal stool. Gastritis can also cause changes in stool. You may notice blood in the stool, which may appear as diarrhea or as black, tarry feces. Blood in a dog's stool can also signal hemorrhagic gastroenteritis and warrants immediate veterinary attention. Causes of gastritis in dogs. Acute gastritis is a common condition in dogs, often stemming from dietary indiscretion, where a dog consumes something it should not. Here are the most common causes. 1. Foreign objects. Dogs may ingest non-food items like clothing, rocks, plastic, bones, or paper. These objects can irritate the stomach lining and trigger gastritis. 2. Food. Certain foods are harmful to dogs and can lead to gastritis if consumed. Examples include grapes, avocados, chocolate, nuts, and coconut. Even excessive amounts of regular dog food can cause inflammation. Additionally, food allergies or intolerances can provoke repeated irritation, leading to chronic gastritis. 3. Toxins. Ingesting toxic substances is another major cause. This includes human medications like ibuprofen, Advil, cleaning products, soil enhancers, and cat litter. Additionally, some plants, such as daffodils, bluebells, and tulips, are toxic to dogs and can cause gastritis if consumed. 4. Underlying diseases. Systemic conditions can also lead to secondary gastritis. These include pancreatitis, liver disease, viral or bacterial infections. Diagnosing gastritis in dogs. Diagnosing gastritis involves identifying clinical signs such as vomiting, appetite loss, and abdominal discomfort. Veterinarians will use the following methods. 1. Owner observations. The vet will ask about any suspicious incidents, such as your dog eating garbage or swallowing foreign objects. 2. Diagnostic tests. X-rays, blood tests, urinalysis, and stool analysis are used to identify the cause. If dietary allergies are suspected, an elimination diet may be recommended. 3. Further examination. For chronic gastritis, additional procedures like surgical stomach biopsies may be required to determine the underlying issue. Treatment and prevention. Once the cause of gastritis is identified, treatment focuses on addressing the specific trigger and managing symptoms. Here's what to expect. Treatment. Dietary adjustments. For acute gastritis, your vet may recommend fasting for 24-48 hours to allow the stomach to recover. Afterward, you can reintroduce bland, easily digestible foods like boiled chicken and rice. Medications. Antibiotics and anti-nausea drugs may be prescribed if necessary. Dogs experiencing severe dehydration from excessive vomiting may require hospitalization and IV fluid therapy. Addressing underlying conditions. Chronic gastritis due to systemic diseases requires simultaneous treatment of both the primary condition and gastritis. Prevention. The best way to prevent acute gastritis is by carefully monitoring what your dog eats. Avoid leaving harmful substances or plants within reach. Even with precautions, gastritis can still occur, and identifying the cause isn't always possible. Prognosis for dogs with gastritis. The outlook for dogs with acute gastritis is generally positive, provided treatment is administered promptly. Chronic gastritis' prognosis depends on the underlying cause. Some dogs may require ongoing treatment even after symptoms resolve. Frequently asked questions. How can I prevent gastritis in my dog? While chronic gastritis cannot always be prevented, you can reduce the risk of acute gastritis by monitoring your dog's diet and environment. Keep toxic foods and plants out of reach and avoid giving your dog access to garbage or other harmful materials. How long is it normal for a dog to vomit? If your dog vomits once or twice over a short period and stops, it's likely not gastritis. However, persistent vomiting over 7-14 days warrants a veterinary checkup to rule out gastritis or other serious conditions. What should I feed my dog after it stops vomiting? Once vomiting subsides, your vet may suggest a bland diet consisting of foods like white rice and boiled chicken. This helps ease the stomach back into normal digestion. By understanding the causes, symptoms, and treatments for gastritis, you can take proactive steps to ensure your dog's health and comfort. Always consult your veterinarian for accurate diagnosis and tailored care.